everybody, it's Dr. Winnie, and I'm here in my office, the King Wellness Institute, and I've got a wonderful patient of mine who has agreed to share his experience with some of the male sexual rejuvenation services that I offer. You know, I have an extensive webinar, and many of you all have seen the webinar, where I go through those procedures in great detail, including the way it feels, what we do, the benefits, and the cost. But I know that that's just me talking, and that you would like to hear it from the perspective of a patient. And so I have Frank here, and that's not his real name, but that's the name that I'm using because I insist on patient anonymity. Even though he's willing to go on camera, I would prefer that we keep his identity private. But he's had several of the procedures that I offer, and so I wanted to ask him some questions so that you guys can hear from a patient what it's been like. Now, Frank, you are in your 60s.
Yes.
Okay, and you've had some health issues, you know, over the years, but your interest in getting the male rejuvenation services was why?
I believe in preventive maintenance, staying on top of things.
You had a couple of procedures. We do, as you all probably know, we do the chair, we do bioidentical hormones, then we do the King shot and the King Cox shot. And Frank, you had the use of the chair, and you had the King shot. So let's start first with the chair. And this is a chair that's here in my office that you sit on, and in the span of 28 minutes, you'll do over 16,000 Kegel exercises. And that's an exercise that many men already know about, women certainly do, that helps tighten the pelvic floor. So we did this on you. It's a protocol of 6 sessions. And what was your experience like after you had it?
After the first session, the nutsack raised.
Yeah. So you noticed right away the appearance.
Right.
Your scrotum, the testicles, everything went up. So you looked like you did when you were younger.
Right.
And you had been doing Kegel exercises before, right?
Yes.
Okay, so you were familiar with them. You know about what they do, about how they tighten the pelvic floor. A lot of women know about this because that's what helps to treat urinary incontinence. But it's a really important exercise for men because it tightens the base of the pelvis. And this is where many of your organs go through, your rectum, your urethra, your penis. And so when that floor gets weak, it affects your ability to really hold it when you're having sex. And so that's what leads to a lot of premature ejaculation. So now when you went through this protocol, what was the outcome? I know physically, you know, you felt a difference in terms of the way you looked, but in terms of your performance, your ability to hold it, how did that affect it?
Oh, it makes it more pleasurable.
Yeah.
Yeah, the longer you hold, the better it is.
Right, and that's a big common complaint that a lot of my male patients have, either that they're having premature ejaculation or that they just don't feel like the encounter can last as long as they would like for it to. And tightening up that muscle with the chair, that helped you.
Yes.
Yeah. Now, we also did the King shot on you. And for those of you that are not sure, the King shot is when we use either exosomes, which are donor-type stem cells, or we use your own PRP, which is a way of harvesting your own natural stem cells, and we inject it into the penis. And what we're doing is we're helping to make new nerves and new blood vessels.
Correct.
So you had that procedure. So were you scared?
No. I was just a little anxious, you know, at the beginning, but I was in good hands.
Yeah.
You know, the team is great.
So was it a painful procedure for you? That's a common question that I get. A lot of guys are like, oh, I'm so worried it's gonna hurt.
Not being painful, it's just being more, your anxiety is up a little bit until you get it actually done. You know, so. And
so afterward, how long did it take before you started to notice something?
I give it at least a 2.5 month period for you to get the results that you was looking for, because it still requires some exercise along the way.
That's right. We do put you in a penis pump. And so you need to be in that pump twice a day for 10 minutes at a time. And that's helping to pull down blood down into the penis. It's really helping to stimulate all of those exosomes and those stem cells that we put into you to help make new nerves and new blood vessels. Now, you also noticed something about the size too.
Yes, but width-wise. Yes, so it's doing well.
Yeah. So you had an improvement in the width. And that's always a good thing. And I tell guys, a lot of men are really interested in length, and certainly the king cox shot can be helpful for that. But when in terms of you're trying to please your partner, it's really the width of the penis that she is going to really notice. And so if you're able to increase the width, and it makes sense that this would happen because we're putting in growth factors that would stimulate new tissue formation. And so men will often notice that. So you notice that too?
Yes.
Yeah. And it took about 2.5 months?
Yes, 2.5 months.
Okay. And overall, like, how do you feel having been through the IMSA protocol and having the king shot done?
I believe men should incorporate this into the yearly examinations, because that needs to be part of their protocol to make sure they have that done, as well as checking everything else.
Yeah, it should be a part of just your overall preventive maintenance.
Yes.
Now you're in your 60s. You look great,
Yes.
by the way, for being in your early 60s.
Thank you.
But we have patients that are in their 40s that are having problems with erectile dysfunction, and you never actually had ED. You were really more just trying to be in front of it and trying to keep yourself from having an issue.
Yeah, I didn't want to be stuck on the porch.
Yeah. Well, the porch is not a good place to be, especially if you can't get off the porch, right? And a lot of older gentlemen tell me they're just sitting there looking at potential opportunities that they're not able to pursue because they're not able to perform.
Correct.
Yeah. So now let's talk about one last thing that is a relatively new part of the services that I offer, and that's the peak performance trochees. Now, you guys may or may not have heard about this, but what I've done is partnered with my local compounding pharmacist to make a trochee. And a trochee is really kind of like it's sort of like a dissolvable tablet that you put under your tongue or in your cheek, and it melts. You don't swallow this. You let it get absorbed into your system. And this is a formula that we put together. It's got tadalafil in it, which is something many of you know for erectile dysfunction. It also has oxytocin, which is a hormone, and apomorphine. And what these do is they really help to relax and calm you. But you've tried these, and we just got these, and I'm already starting to sell quite a number of them. But you tried them out of curiosity, and tell me, what was that like for you when you took them?
It was an experience of being able to go on demand. So, in other words, if you have a 24 to 36 hour period involved, you can you don't have to worry about underperforming, because you'll be able to perform by using it.
That is exactly the benefit of this. There's different products out there to help with men with their performance. Cialis, Viagra, Levitra, and they all work in different ways in terms of the length of time that they're helpful to you. And the tadalafil, which is one of the ingredients in this trochee, will give you the ability to be sexually active up to 36 hours. And so that's the real benefit, is that you don't have to be kind of watching, oh my gosh, I've got 2 hours and I've got to get it in, or otherwise the pill is going to wear off and I won't be able to perform. You've got the ability to do it. And that sort of, to me, kind of mimics the way you were when you were more sexually potent, where you didn't worry about, time.
You wasn't focused.
You just, whenever, if ever, you used a term that you described, locked and loaded.
Lock and load the 10-round magazine.
Yeah, well, you were a military guy, so I guess you have to describe it that way. But it's about just being ready. And I've had so many men tell me that their anxiety is that they don't know if they're going to be able to perform. That if something comes up, they're with their sexual partner and they decide that they want to have a sexual experience, they're worried that they don't think they can do it and it's going to ruin the whole thing. When you have this on board and it's in your system for a good 36 hours, you don't have to worry about that.
Right.
You're going to be able to perform. Now, you also talked about anxiety, that this really kind of just cools you out, just sort of relaxes you.
Yeah. And basically, when I've taken the product, it was like I started relaxing more, so it works for me like that. So it may work for somebody else the same way. We all made up differently. So it relaxes me, but at the same time, later on, 24 hours later, or whatever, you know, you're waking up harder, you're doing all these natural things that was already a natural move where you wasn't at one point, and now you are.
Right. So like morning erections,
Yeah.
that comes back. And you know, again, that has a lot
Hard.
to do hard and more firm when you have the erection. And so this is where all of these things sort of dovetail. They kind of all work together. The IMSILA chair, the King shot, and now the peak performance trochees. You know, they're all working together to help make you a more effective sexual partner. And I do know that anxiety and stress is a big part of what happens when guys are having ED issues. And so that alone can affect your ability to become erect because you're worried that you won't. And so you end up being so nervous that you won't until you don't. And so that's where the peak performance can be very helpful. The oxytocin and the apomorphine in there is very relaxing. And so it just kind of cools you out and puts you in a mindset so that you're able to perform. So, okay. Let's close this out by giving some advice to men that are watching, because I'm all about information. You know, that's why I did the webinar, and I tried to cover all of the services and how they work, what they do, and I felt that bringing you on board to talk about it from your experience would also be great. But now let's speak to the guys, because this is mostly men that are watching this, that have maybe seen the webinar, seen some Instagram or Facebook posts that I've done about this procedure, and they're kind of thinking, I wonder if this would be something that would be good for me. I'm having a few issues, you know, I'm kind of not where I was, you know, and I'm, this doctor's trying to do something to help me. Wow, I've not too many doctors out there doing this. Is this for real? I mean, is this like some kind of sham? Is she like some kind of crazy doctor sticking needles in men's penises? I mean, what is this? Is this for real? Is this worth it? You know, and by the way, you know, we charge anywhere from like I think $2,500 to $4,500 for our procedures. There are doctors out here that are charging $10,000 for this, and we're not trying to do all that. My passion is helping men, and so we do enough so that it's makes sense for us to do, but also is affordable to our patients. And we do have financing, by the way, and that's all included in the webinar. We've got ways to get you covered. So don't let money be an object, even regardless of your credit score. It doesn't matter. We have ways to get you covered. But for guys that are thinking about it and they're feeling like, you know, if this really works, this could be huge for me, what would you tell them?
I suggest they get their package checked.
Yeah.
You know, just as you would go in there for any other thing that you'd be doing for your medical purposes.
Yeah.
Get everything checked. Get yourself updated. You know, and learn from it. You know, because if you have bathroom issues, all that leads up to still dealing with your package.
Yeah.
You know, so this will help you in many ways. So I suggest that you get involved.
Yeah, fight for yourself. Take care of yourself.